Greetings and salutations one and all. Welcome to another night of the night shift right here on kevinstew.com. Welcome to Healthy Love, what we do each and every Tuesday right here on the night shift with Kevin Stew.
Pretty,
kicking it off with Pretty.
them, man, and only.
A track called No Standing Up.
Start waking up, wake it up, start waking up, wake it up, start waking up, wake it up, start waking. All I want you do before the beat drop. No standing up, every single man I want you to jump. No standing up, every single girl I want you to walk. No standing up, yeah, no standing up, hey, hey, no standing up. Forget all your problems, get ready to face.
Yeah, who does do it?
Who does find the best? Start to jump up and beat the chest. Say who does?
Yeah, who does do it the best?
Who does? Train the best. Who does?
Yeah, that Eastern Caribbean slang, you know?
No standing up.
The sound of Pretty. It's called No Standing Up. I want to say welcome to each and everyone locked in right now. Those on TuneIn Radio, the night shift with DJ Kevin Stew. Big ups to the affiliate broadcasters around the globe. Those over there in the UK, top of the morning to you. One Harmony Radio. I want to say big ups to those out of New York, locked in on Ireland worldwide, exhibiting the power of music. Hail ups to those over in New Jersey, NIE Radio. Big up the motivator. I want to say greetings to those on WGLRO, on Olliwap Music Group, and Dusik. Olliwap Radio and Dusik Media Groups. Right. I mix them up sometimes. I do apologize. Thank you guys out of Texas. Truly appreciate love you.
You show me who does, bet the best. Who does, drink the best.
Big ups to those who are locked in on the Foundation Radio Network, ClintonLindsay.com.
Who does, find the best. Who does, drink the best. Who does, bet the best. Start to jump up and beat.
Much love to you. I want to say thank you to my segment sponsor, Pulse Media Group. When being in the moment is priceless, give them a call for innovative streaming and recording solutions. What can they do for you? They can stream your event, whether it be a church service, a funeral, a wedding, a graduation, a party, seminar, Oh, I said seminar already, right?
Drink the best, who this, why the best? Start to jump up and beat it.
Get them a call 754-999-6020 and tell them you heard about them on the night shift to DJ Kevin Steele.
Start to jump up and beat the chest. No standing up. No standing up. No standing up. No standing up.
The track is called No Standing Up.
Uptown to downtown.
Inviting you to call a friend, tell a friend. Tell the friends of your friends, tell your enemies, enemies of your friends, and friends of your enemies. Tell everybody, it's a night shift with DJ Kevin Steele on live. Oh, did I big up those who are locked in on Facebook Live? Yo, how you doing?
Uptown to downtown.
Glad to have you all. And of course, those at the home of the night shift to DJ Kevin Steele, where you're encouraged to have acceptance through enlightenment. So glad to have you. Couldn't do it without you. You have my word, I wouldn't even try. Those of you on Facebook Live, remember it's only temporary. It's just a segment broadcast, so don't get too comfortable. Use the link. In fact, you see it in the description. Let me go ahead and put it in the comments also, so that we have that covered. And you can share it with everybody. Yeah? Everybody. So there it is. And let me pin it also. So y'all can share that with your friends. Yeah? Cool. Alright, so sciatica is what we're going to be talking about tonight. And if you or anyone that you know has experienced the pain from sciatica, you would be able to relate to some of the information that I'm presenting tonight. Now, do you know everything that there is to know about what sciatica is? Well, I don't know. Is there more that you could learn about what sciatica is? Quite possibly. There's always room to learn something else. Now, before I get into it too deeply, I want to tell you, you can call, you can text, you can WhatsApp, you can Telegram, 773-789-STEW. That's 773-789-7839. Numbers to use to get in touch, and you can be a part of this broadcast that way. Of course, you can also jump into the Stew Pot on kevinstew.com. Others call it a chat room. We fancy over here on kevinstew.com. We call it the Stew Pot. It's where we keep things interactive and bubbling. So come on in. You can remain anonymous if you choose, or you can put your name so I know who it is that I'm communicating with. All right? Now, sciatica. Getting right into it. Sciatica is a term used to describe nerve pain in the leg that is caused by irritation and or compression of the sciatic nerve. Sciatica originates in the lower back, radiates deep into the buttock, and travels down the leg. So that pain that you feel in your back, your lower back, and then it goes into your bottom is not constipation. Well, then again, maybe it could be. But if it goes down your leg, then yeah, we're getting into something else at that point. So what does sciatica really feel like for those of us that haven't experienced it? The symptoms of sciatica are commonly felt along the path of the large sciatic nerve. And sciatica is often characterized by one or more of some features. Now, these features include pain, and this pain is typically felt like a constant burning sensation or a shooting pain starting in the lower back or in the buttocks and radiating down the front or back of the thigh and goes down your leg to your feet. It could go down all the way to your feet. there's also a numbness. And the pain that you feel may be accompanied by this numbness. And this shows up in the back of the leg. Sometimes there's a tingling or weakness that may also be present. Now, there's also one-sided symptoms where it typically affects just one leg. The condition often results in a feeling of heaviness in the affected leg, but rarely both legs are affected together. Now, not to say that it cannot happen, but it is rare. Sciatica symptoms may feel worse while sitting, trying to stand up, bending the spine forward, twisting the spine, lying down, and or while coughing. The symptoms may be relieved by walking or applying a heat pack over the rear pelvic region. And just hearing that, it doesn't sound like fun at all. Now, it is important to note that any type of lower back pain or radiating leg pain is not sciatica. Sciatica is specific to pain that originates from the sciatic nerve. And you might wonder, okay, so the sciatic nerve is where again? Here we go. So on this image that those of you who are watching on Facebook Live and on kevinstew.com, you see that nerve on the side where there's no skeleton? Yeah, that big nerve right there, that's the sciatic nerve. So that is the source of your discomfort. Now, sciatica is a term used to describe a set of symptoms caused by an underlying medical condition. It is not a medical diagnosis. Common medical conditions that may cause sciatica include a herniated lumbar disc, lumbar spinal stenosis, lumbar degenerative disc disease, or general degenerative changes in vertebrae or discs, spondylone. Now, this one I had to work on earlier, and I kind of forgot it. So it's spondylolisthesis. Okay, I hope you got that. It's spondylolisthesis. Then you have muscle spasms and or inflammation of the lumbar and or pelvic muscles. And you have sacroiliac joint dysfunction. I just needed to make sure that I got those out right. Now, for those of you that might be in the know of some of these conditions, or experience them personally, again, I invite you to use the number 773-789-STEW, 773-789-7839, and you can share with the rest of us what this experience is like and some of the things that you may do that help. Now, rarely tumors, blood clots, or other conditions in the lower spine may cause sciatica, but it is possible. In addition to the terms that identify the underlying pathologies that cause sciatica, the terms lumbar radiculopathy or radicular pain may be used interchangeably with the term sciatica. Now, I can tell you, prior to, hey, cuz, prior to looking over this information, I had never heard of lumbar radiculopathy. Never. Or radicular pain. Never heard of it. But it makes sense if they, I guess because of the radius, that being that bone in the leg. So, you know, just off the top of my head, I'm thinking that that's what it might be. All right, so moving forward really quickly, but getting into more detail because there's quite a bit of information on sciatica. I didn't even realize when I first looked up sciatica and what it is. I found some pretty basic information. However, there is a whole lot more than I had initially found. Now, the sciatic nerve is the largest single nerve in the body and is formed by the union of 5 nerve roots in the lumbar and sacral spine. There are 2 sciatic nerves in the body, the right and left nerves, supplying the corresponding lower limb. So, one to your right leg, one to your left leg. And again, we can see that in the image. So, there are your spinal nerves which join to form your sciatic nerve, those 5. The L4, L5, S1, S2, and S3 nerves. Alright, so you're getting a little bit of a biology lesson along with this information tonight. Now, a few anatomical characteristics of the sciatic nerve include the origin. So, its starting point is at the level of the spinal segment L4. The sciatic nerve is formed by the merging of spinal nerve roots from L4 to S3. The emerging nerve roots converge into a single sciatic nerve, making it large and bulky, typically up to 2 centimeters in diameter. The next thing is the path. After its individual contributions end, the sciatic nerve exits the pelvis through the greater sciatic foramen below the piriformis muscle. The nerve then runs along the back of the thigh into the leg and finally ends in the foot, which is why you'll sometimes have that pain traveling down your leg into your foot, and then you'll also have that numbness because it goes all the way down. Then you have the branches. So you have the origin, you have the path, and you have the branches. The branches, the sciatic nerve branches into 2 main divisions behind the knee. The tibial nerve and the common peroneal nerve. The tibial nerve courses down and supplies the back of the leg and the sole of the foot. The common peroneal nerve supplies the foot and the front of the leg, and the foot. Now, rarely, the sciatic nerve may split into 2 nerves near the sciatic foramen, which merge again into a single nerve. The specific sciatica symptoms largely depend on the nerve root that is pinched. For example, an L5 nerve impingement can cause pain in the back of the thigh and weakness in lifting the big toe and ankle. So that's the L5 nerve. So you can pinpoint the nerve down to the action that you can or are restricted from doing. For those that are in the know when trying to pinpoint which nerve is damaged or pinched. Now, often a particular event or injury does not cause sciatica. Rather, it tends to develop over time. Now, sciatica affects 10 to 40% of the population, typically around the age of 40 years. Sciatica is found to be common in certain types of occupation where physically strenuous positions are used, such as machine operators or truck drivers. Specifically, people who often bend their spine forward or sideways or raise their arms frequently above the shoulder level may be at risk of sciatica. So, wait, does that mean that tennis players or gymnasts are prone to sciatica? Where are my doctors at? The vast majority of people who experience sciatica typically get better within 4 to 6 weeks with non-surgical sciatica treatments. If severe neurological defects are present, recovery may take longer. An estimated 33% of people, however, may have persistent symptoms up to a year. When severe nerve compression is present with progressive symptoms, surgery may be indicated. So, at what point then does sciatica become serious? Certain symptoms may indicate a serious medical condition, such as cauda equina syndrome. There is also infection or spinal tumors. These symptoms may include, but they're not limited to, progressive neurological symptoms such as leg weakness, symptoms in both legs, bowel or bladder dysfunction, and sexual dysfunction. Now, I'm pretty sure that the last of those four trigger something in some people, because to know that severe sciatica can cause sexual dysfunction, well, think about it. Any kind of pain that you're experiencing like that should cause some dysfunction, right? If you're not comfortable, then performance is going to suffer. Now, it is advised to seek medical attention immediately if any of those symptoms develop. If you have the progressive neurological symptoms being leg weakness, if you have symptoms in both legs, if you have bowel or bladder dysfunction, and or sexual dysfunction, any or all of those, you need medical attention immediately. Sciatica that occurs after an accident or trauma, or if it develops in tandem with other symptoms like fever or loss of appetite, is also cause for prompt medical evaluation. So that then makes me ask the question, could sciatica actually develop from things like pregnancies? Or, as they said, since there are some jobs like being a truck driver, or if you raise your arms above your shoulders often. Now, that part of it, I don't quite understand. It must have something to do with the whole workings of the anatomy. And I guess if Dr. J Love was on today, I probably should have given her a call much earlier. Because she would have been able to help me out with this question here. How is the raising of the arms above the shoulder a contributing factor to sciatica? I don't know. Anyway, In just a couple of minutes, we're going to take a quick little break. And we're also going to say goodbye to those on Facebook Live. So if you're tuned in on Facebook Live, just use the link that is pinned in the comments and come on over to kevinstew.com, where we continue the information as it relates to sciatica. And I do also encourage you to call somebody, tell somebody, share with somebody. Let them know Healthy Love is on tonight. And we're talking about sciatica and sciatica symptoms, possibly how to treat it if we can get to. We'll try to squeeze in as much information as we can as it relates to sciatica tonight, because I've found quite a bit of it. All right, so we'll see what we can squeeze in. We're gonna do it right now. We're gonna take a quick little break and say goodbye to those on Facebook Live. You guys over on Facebook, gonna take care until we do it again tomorrow when we wrap up this week of the Night Shift to DJ Kevin Stew. Remember also, tomorrow I'm addressing the subject of gender biased wage disparities, and with me I'm gonna have 3 guests. There will be Ryan Greensberg out of South Florida, Dr. Keisha Gray, also out of South Florida, and former Reggae Girls goalkeeper Nicole McClure. So they'll be joining me, and we'll be talking about wage disparities and the influence of gender on that. So you don't want to miss Real Talk tomorrow night, because it can be a little bit of a touchy subject, but it's real. So we're going to take a quick little break. When we come back, we're going to look at sciatica symptoms. All right, so 773-789-STEW gets you in touch. Call and share your information. 773-789-7839. Once again, thank you to my affiliates. We'll be right back after these.
Pulsey Media Group, innovative streaming and recording, has done it again. A new way to get your business in full view of your neighborhood consumer through AdShare TV. It's available in your neighborhood today. It's easy. Just call us 754-999-6020. Become a host today and place a TV monitor in a strategic location so it's easy to see. Get a 1-minute video ad or longer that plays anywhere in our network. Can't be a host? No problem. For a few dollars, we'll run your 30-second video ad. A host can run announcement specials like buy one get one free or discount ads. Let's turn your flyers into a 30-second video with music or a voiceover, or let us create and run your video ad with a spokesperson. Take advantage of our early enrollment discount. Join us today. Your ad will be seen at least 30 times per day in your AdShare TV neighborhood. It's easy. Just call us 754-999-6020. AdShare TV, part of Pulsey Media Group.
Imagine having our own Caribbean Center.
Imagine a museum highlighting our history and the contributions of Caribbean people to the world.
Imagine being able to visit and learn about the islands we call home.
In a place where our kids can see and feel their cultural heritage. You can make this vision come to life.
Help us create this first-of-its-kind space
that all Caribbean people can be proud of. Your contribution to Island Space Caribbean Museum will help this dream come true.
Visit islandspacefl.org/GoFundMe.
Visit islandspacefl.org/GoFundMe.
Visit islandspacefl.org/GoFundMe and donate today.
It takes an entire village to raise a child. Hello, I'm Paul Campbell, here to talk about Palace. Peace and Love Academic Scholarship. This non-profit group supports students facing serious obstacles from entering or continuing their studies, not because the grades are failing, but due to the lack of financial support.
Over the past 8 years, Palace has awarded 600 scholarships valued at approximately 50.3 million Jamaican dollars, or 415,000 US dollars.
Together, we must build a better future for our children. Please visit www.palace1.org and make your donation to brighten the future of a deserving child. Palace, preserving young minds for posterity.
Come on, smile. Oh, honey, he's still not smiling.
Maybe he's not a smiler.
Yeah, maybe he's just not a happy baby.
Maybe he's just being a boy.
Or maybe he's teething.
Maybe it's just a phase.
Maybe he has autism, and we can definitely do something to help.
Maybe is all you need to find out more about autism. No big, joyful smiles by 6 months is one early sign. Learn the others at autismspeaks.org/signs. Brought to you by Autism Speaks and the Ad Council.
Yes. Akar Mantino, I'm making notes right now. You are locked in to DJ Kevin Stew on the night shift.
You was my girl from the start. I would never break your heart. Don't listen to everything they say. You know that I ain't out there playing. Number one on the chart. You know how to leave your mark. You're still asking me if I'm staying, but it don't need explaining. You and me together, it will be forever. Unbreakable, but we have unbreakable. You and me together, it will be forever. Unbreakable, but we have unbreakable. Vibes never stop, lit on a yacht. Champagne a pop, everything must smile. Oh, you're so bad, but look so simple. Smile that you got showing off your dimples. You a bad gal, we do bad gal things. Say you want a real G. Give it to her good, she a beg for some more. She wanna feel me. You and me together, it will be forever. Unbreakable, but we have unbreakable. You and me together, it will be forever.
I want to welcome you back to the broadcast.
Every time I'm with you, baby.
This is the sound of Lindo.
Checking up on you.
Track called Unbreakable.
You daily. We can get high on a natural.
Lindo is the son of veteran singer, songwriter, producer Hopeton Lindo.
You and me together, it will be forever. Unbreakable, but we have unbreakable. You and me together, it will be forever. Unbreakable, but we have unbreakable. You was my girl from the start. I would never break your heart. Don't listen to everything they say. You know that I ain't out there playing.
The track is called Unbreakable. Brand new music from him.
Just still asking me if I'm staying. But
yeah, man, I like this one, don't you?
bad girl things, say you want a real G. Give
I
it
want to say thank you to my segment sponsor, Althea and her Healing Heavenly Hands. Althea is a licensed massage therapist that operates out of Broward County, North Miami-Dade, and South Palm Beach counties. She comes to you, bringing her table, her oils, her Healing Heavenly Hands, and over 20 years of experience. And she also comes COVID-free and would like to leave that way. Outside of paying her, she only asks that you get off her table and go sleep somewhere else when she's done. But if you're in Broward County, North Miami-Dade, or South Palm Beach counties, or you plan to be, give her a call, 954-655-9000. That's 954-655-9000, or email her at thealater@att.net. That's THEALATER @att.net. Listen, you can also ask her about personal training services, because she is certified as a personal trainer.
You know how to leave your mark. You still asking me if I'm staying, but it don't need explaining. You and me together.
The track is called Unbreakable.
Forever unbreakable. But we have unbreakable. You and me together.
Some people feeling some sciatic pain, they would like, just break off my legs, break off my lower body, do something, please, just take this pain away. I don't know if it is annoying or it is just that painful. I was speaking with someone you might remember, Nurse Marva Riley. Happy Earth Date, Marva. Marva Riley wrote the book Eat, Sleep, Meditate, which and we've talked about the book on the night shift, and we've had her on a number of occasions. And Marva was telling me earlier that she used to suffer from sciatic pain, but with changes in her lifestyle, she doesn't suffer from the sciatic pain anymore. Now, does that work for everyone? I don't know. I guess we'll know if everyone else calls and tells us about it. But we'll try to address treatment before we get out of here. The symptoms of sciatica. Oh, well, before I do that, let me quickly shout out my broadcast affiliates. One Harmony Radio up there in the UK, or across the pond in the UK. Big ups to you. Those in New York, NIE, Island Worldwide, exhibiting the power of music. NIE Radio out of New Jersey. Big ups to you. The Foundation Radio Network, ClintonLindsay.com. Much love. And out of Texas, WGLRO, the People Station, home of the Donnie Walker Morning Show. Aliwap Radio, Dusik Media Groups, thank you for taking the night shift with DJ Kevin Stew. Alright, so the symptoms of sciatica. For those of you just tuning in, it's Healthy Love Night, and we're looking at sciatica. In its simplest, I can't put it any simpler. We're just looking at sciatica. Symptoms of sciatica may range from infrequent and irritating to severe and debilitating. The symptoms depend on the specific spinal nerve root that is irritated and or compressed at the origin of the sciatic nerve. One or more nerve roots may be affected together. Now, while some symptoms are specific to nerve roots, other symptoms are common and occur in all sciatica types. Usually, sciatica affects one leg at a time, and the symptoms radiate from the lower back through the lower back or in the buttocks to the thigh and down the leg. Sciatica may cause pain in the front, back, or sides of the leg and thigh. And again, there are a few common symptoms that are seen in sciatica. Now, some of these symptoms include pain, which may be constant or intermittent. The pain is usually described as a burning sensation or a sharp shooting pain. The pain is usually more severe in the leg compared to the back. Leg pain commonly occurs more in the calf region below the knee compared to other parts of the leg. There is numbness, tingling, and or pins and needles sensations that may be felt at the back of the leg. then you may experience weakness in the leg and foot. A feeling of heaviness in the affected leg may make it difficult to lift the foot off the floor. So I guess it can be really debilitating. Now, certain postures may affect sciatica pain. Sciatica pain may feel worse while sitting, trying to stand up, standing for a long time, bending the spine forward, twisting the spine, and or while coughing. Something as simple as coughing. Jeez. I feel it for those that experience sciatica pain. Pain may increase or remain constant while lying down, causing disturbed sleep. Lying on the back with the knees slightly elevated or propped up on a pillow, or lying on the side with a pillow between the legs may help relieve the pain in such areas. But isn't it generally recommended to sleep that way anyway, because it eases pain, or it eases stress to the spine? And I guess if it's going to ease stress on the spine, then it would make it would prevent the pinching of the sciatic nerves. So that kind of makes sense. Now, the pain may be relieved while walking, applying a heat pack to the rear pelvic area, or doing pelvic exercises. Now, it might be interesting to note that as I was looking up information about sciatica, Kegel exercises came up. And I was like, wait, Kegels? What does Kegels have to do with a pain running down the leg? Well, if you think about it, you're talking about a pain that originates in the pelvic area. So, maybe, just maybe. Well, when we get to the treatment section, we'll see. Now, there may be other sciatica symptoms that are specific to the affected nerve root. The sciatic nerve, again, is formed by the combination of 5 nerve roots. And I should put up that picture again for you guys. Here we go. So you have the L4, L5, S1, S2, and S3 spinal nerves. And those come together to form the sciatic nerve. So it was mentioned earlier about the causes of sciatica. Mentioned briefly. The mechanism of sciatic nerve injury is either the result of direct nerve compression, inflammation, an abnormal immune system response of the body, or a combination of all these factors. Nerve compression, inflammation, abnormal immune system response of the body. Now, research suggests that up to 90% of sciatica is caused by a lumbar herniated disc. The herniated disc typically compresses one or more spinal nerves, nerve roots that form the sciatic nerve. So it could be one, or it could be multiple in the 5. A lumbar herniated disc can cause sciatica in 2 ways: through direct compression of the sciatic nerve that occurs when a lumbar disc bulges, or when the soft inner material of the disc leaks out or herniates through the fibrous outer core and presses against the nerve, or if there's chemical inflammation, where an acidic chemical irritant from the disc material may leak out and cause inflammation and irritation in the area around the sciatic nerve. Now, a herniated disc may compress the sciatic nerve on one side, causes symptoms in one leg, or the disc may bulge or herniate from both sides, causing symptoms in both legs, which is called bilateral sciatica. Now, this may also be caused by two adjacent segment discs herniating on either side, although this is quite rare. Now, there's also degeneration of tissues in the lumbar spine that can compress or irritate the sciatic nerve. Degeneration of the facet joints can also cause the synovial fluid in the joint's capsule to inflame and increase in bulk. Degeneration of vertebral bone may cause abnormal bone growths. These abnormally bulky tissues in the lumbar spine may cause compression of one or more nerve roots of the sciatic nerve. Degenerated intervertebral discs may secrete inflammatory proteins, causing inflammation of the sciatic nerve. So, of course, the doctors have quite the task identifying which of these causes they have to address. Now, spinal stenosis, which is the narrowing of the spinal canal and is relatively common in adults older than age 60, is also a possible cause. Research suggests that lateral recess stenosis may be common in causing sciatica in the elderly population. Then there's a condition called spondylolisthesis. Did I leave out something? It's spondylolisthesis. And this occurs when a small stress fracture causes one vertebral body to slip forward on another. For example, the L5 vertebra may slip forward over the S1 vertebra. And then sciatica may result from the nerve compression following the disc space collapse or fracture or forward slipping of the vertebral body. Spondylolisthesis may cause bilateral sciatica and is more common in younger adults. Now, these conditions may develop over time or spontaneously due to trauma or physical stress injury. Motor vehicle accidents, sports injuries, or falls may cause direct injury to the sciatic nerve. Conditions such as spondylolisthesis or herniated discs may develop from physical stress injuries such as from weightlifting. My question is, why don't they mention pregnancies when they're talking about sciatica? Alright, when you talk about weightlifting, consider carrying a life in your body and the changes that your body will go through, especially in the second half of the second trimester into the last trimester. All those changes. So wouldn't it be easy then for there to be some shifting of the spine? You know, sleeping positions change, standing positions change. There are all these changes in posture. But yet still, there's no mention of changes like that contributing to sciatica. Now, I don't know if it is just that it is left out of this particular article, or this particular set of information, or what. I don't know. 7 minutes to the top of the hour. 7 minutes before we take another quick little break. Diagnosis of the underlying cause of sciatica is quite essential in formulating an effective treatment plan and managing sciatica pain. When sciatica is suspected, a doctor will take a medical history and conduct a physical examination. Medical imaging tests and diagnostic nerve blocks may be appropriate in some cases. Now, the goal of conducting a physical exam and review of medical history is to identify the pain pattern in a patient's leg. Sciatica pain typically follows the areas of skin called the dermatome that are supplied by the sciatic nerve. The pain may also include the other deeper tissues outside the classic dermatomal areas called dynatomes. It is believed that pain from all the nerve roots that comprise the sciatic nerve usually have a dynatomal distribution, except S1 nerve pain or classic sciatica, which typically involves a dermatomal pain pattern. I hope you guys are staying with me with this one. Now, during the physical examination, as according to spinehealth.com, the doctor may check for localized pain in the low back, buttock, thigh, and leg. The response to leg movements that elongate the nerve, the response to certain stimuli such as gently pressing the toes or calf region. And the doctor may also conduct certain clinical tests to check for sciatic nerve pain. Now, a few examples of clinical tests for sciatica would include the straight leg raise test, the SLR test. Now, this test includes the patient lying on their back and lifting one leg at a time with the other leg flat or bent at the knee. A pain encountered while lifting the affected leg usually indicates sciatica. Pretty simple enough clinical test, right? Then there's a slump test. And this includes the patient seated upright with hands behind the back. The patient bends or slumps forward at the hip. The neck is bent down with the chin touching the chest, and one knee is extended to a degree possible. If pain occurs in this position, sciatica may be present. These tests, however, may be positive only when the sciatic nerve is mechanically compressed at any point along its origin, such as from a herniated disc. Other causes of sciatica, such as inflammation or chemical irritation of the nerve, may not cause pain in these tests. So, then, you're going to have to look elsewhere. Your doctor is going to have to pull out all the stops in finding or making this diagnosis. Now, medical history may include the doctor reviewing the onset of pain and other symptoms, so it may be good to keep a journal. The type, nature, and the duration of the pain, trauma or injury to the back or hip area, the occurrence of muscle spasms or cramps in the pelvic region, and decreased strength in the leg. Now, if sciatica is suspected, some doctors may order medical imaging or diagnostic nerve block tests. These tests are used to confirm the cause of sciatica. Medical imaging or diagnostic injections also help plan surgeries or other invasive treatments. So, again, typically, your sciatica can be treated within a few days with some exercise, and walking or applying heat generally helps. But is there any long-term treatment that you can do? We're going to find out in a few. We're going to take another quick little break, and when we come back, we're going to talk a little bit more and then get into musical therapy. Call your friends. Tell your friends. Call an enemy. Call the friends of your friends, friends of your enemies, enemies of your friends. Tell everybody. It's the night shift with DJ Kevin Stew, Healthy Love Night. And tonight, we're talking about sciatica. Of course, I do encourage you guys to use up the number 773-789-STEW, 773-789-7839. Call, text, WhatsApp, Telegram, or jump into the stew pot on kevinstew.com. Again, the stew pot is what others call a chat room, but because we're fancy, it is called the stew pot. It's where we keep things interactive and bubbling on kevinstew.com. So come on over, be a part of the broadcast, and let's share information. We'll be right back after these few messages.
When being in the moment is priceless, consider the ability to share that moment. If you can video it, you can broadcast it. And Pulse E-Media Group has the tools you need. Weddings, birthdays, funerals, graduations, church services, parties, seminars, you name it. Pulse E-Media Group can provide you with a secure medium controlled by you to broadcast your event. Contact us at www.pulsemediagroup.com for more information. Pulse E-Media Group, when being in the moment is priceless.
Yes, my people, check out I Red Funks on Reggae Global Radio every Saturday at 8 p.m. with Kev Stew, where I'll give you a pre-life, brand new, good for you. Kick it like a ball if it was a dance song. You hear that?
Today in school, I learned a lot. In chemistry, I learned that no one likes me. In English, I learned that I'm disgusting. And in physics, I learned that I'm a loser.
Today in school, I learned that I'm ugly and useless. And in gym, I learned that I'm pathetic and a joke. In history, I learned that I'm trash.
Today in school, I learned that I have no friends. In English, I learned that I make people sick. And at lunch, I learned that I sit on my own because I smell. In chemistry, I learned that no one likes me.
In biology, I learned that I'm fat and stupid.
In English,
And in math, I learned that I'm trash.
the only thing I didn't learn in school today.
The only thing I didn't learn today.
The only thing I didn't learn
is why no one ever helps.
Kids witness bullying every day. They want to help, but they don't know how. Teach them how to stop bullying and be more than a bystander at stopbullying.gov. A message from the Ad Council.
Matthew 28:19 says, "Go ye therefore and teach all nations." With this in mind, and encouragement received during a South Florida media conference, The Church Links was birthed. The Church Links is an interdenominational worship service portal for churches, providing the tools to spread the word through technology in a cost-effective way. The Church Links, www.dahchurchlinx.com. Your links to worship and praise. Greetings and salutations. This is DJ Kevin Stew inviting you to bubble up and simmer down with me in the Saturday Stew right here on Reggae Global Radio. Get ready for the special segment called The Secret Ingredient, where you may hear from your favorite artist or producer. Saturday Stew happens every Saturday at 8 p.m. Eastern Time exclusively on ReggaeGlobalRadio.com, where we get high on reggae.
Hey yo, this is Carman to let you know that right about now you are logged on to DJ Kevin Stew on the night shift. Don't move.
In vain, love hurts, but I love the pain. Shots of Novocaine through my brain. I'm about to go insane. I don't wanna lose you, baby. If I did it would drive me crazy. Without you everything seem easy. Stay close to me where you're supposed to be. You say I'm selfish cause I need you for myself. It's bad for my health, girl, but I don't want nobody else, yeah. And I know I could be a little extreme. You brighten up my world like I beach. Nobody must say oh love is blinding, but you bring the clarity like me Visine. The girl of my dreams, I melt like ice cream. Anytime you're around, I'm in the presence of a queen. You show me love that's sweet like 16. Or a fruit from a tree, or a cool summer breeze, yeah. Right. That's why me can't stand to lose you. But you're moving away and I can feel it. Now you're telling me you need some space. My mind just start figure race. That's why I don't wanna wait in vain. Love hurts, but I love the pain. Shots of Novocaine through my brain. I'm about to go insane. I don't wanna lose you, baby. If I did it would drive me crazy. Without you everything seem easy. Stay close to me where you're supposed to be. Don't give up on me now. Can't let the negativity come between us, girl. I know you got your fears, anxiety and despair. Talk to me, don't push me away. I need to hear all the words you've got to say. We can take it day by day. So baby, won't you just stay here? If you leave me, I will cry until me eye them run dry. Can't sit down cause you know why I'm a stand-up guy. Without you, every little thing won't be alright now. Through the darkness, you were my light. So right to know I'm just lost in the night. I might be okay, then again I may never, cause we belong together. You know that I don't wanna wait in vain. Love hurts, but I love the pain. Shots of Novocaine through my brain. I'm about to
want to welcome you back to the broadcast.
I don't wanna lose.
In the background, the sound of Paul Anthony.
Drive me crazy. We don't
track called Love Hurts. So does Sciatica, apparently.
I don't wanna lose you, baby. If I did it would drive me crazy.
I want to say thank you to my segment sponsor, Reggae Global Entertainment.
You're supposed to be.
Reggae Global will act as your booking agents, take care of your tour management, handle your legal contracts, your legal service referrals, music production, marketing and promotion, and so much more.
The words you've got to say. We can take
Give them a call, 954-804-8199, or check them out online, reggaeglobalentertainment.com. And tell them you heard about them on the night shift to DJ Kevin Stew.
Every little thing won't be alright now. Through the darkness, you were my light. So right to know I'm just lost in the night. I might be okay, then again I may never, cause we belong together. You know that I don't wanna wait in vain.
Zone of Paul Anthony.
Love the pain. Shots of Novocaine.
It's called Love Hurts.
I'm about to go insane. I don't wanna lose you, baby. If I did it would drive me crazy. Without you everything seem easy. Stay close to me where you're supposed to be. I don't wanna wait in vain. Love hurts, but I love the pain. Shots of Novocaine through my brain. I'm about to go insane.
If anybody in South Florida knows a chef or is a chef,
without you everything seems
I know of a restaurant that is looking for one.
supposed to be.
Hit me up, 773-789-STEW, 773-789-7839, and let me get you in touch, eh? Alright. Now, back to the matter at hand. We're looking at sciatica tonight, and that's the subject we're looking at here in Healthy Love, if you're just tuning in. And if you are, welcome to the broadcast. Now, we're looking at how to treat sciatica. It is advisable to treat sciatica as early as possible in order to avoid the progression of symptoms. Now, sciatica treatment may include both non-surgical and surgical methods. Typically, non-surgical methods are tried first. Kind of makes sense, right? You want to do the less invasive thing. Surgery may be indicated when the underlying cause is severe and or progressive neurological deficits such as leg weakness occurs. Sciatica treatment usually starts with the non-surgical methods and includes some combination of physical therapy, medications, therapeutic injections, and alternative therapies. The first line of treatments of sciatica typically include some combination of physical therapy and alternative treatments along with the injections. Acute sciatica usually gets better with 4 to 6 weeks of non-surgical treatment. For chronic sciatica, with pain lasting over 8 weeks, treatment time may be a bit, it should really take a bit longer. But it may take a bit longer and may depend on the underlying cause. Physical therapy for sciatica incorporates a combination of strengthening, stretching, and aerobic conditioning, and is a central component of almost any sciatica treatment plan. Therapeutic exercises may also be added to a physical therapy program. According to spinehealth.com, the goals of physical therapy and exercises for sciatica include strengthening the spine and muscles of the lower back, abdomen, buttocks, and hip. Now, taking those areas into consideration, no, it doesn't stop there, but I'm going to pause for a moment. Taking those areas into consideration, I can see where pelvic floor exercises, Kegels, would come into play in the treatment of sciatica. It makes sense. Now, going on with therapy and exercises, increase core strength. So I guess that would be things like high intensity training or even yoga. Stretch tight and inflexible muscles such as the hamstrings. Encourage the exchange of fluids and nutrients in the body by light aerobic exercises such as walking, swimming, or pool therapy. So, if you find that you suffer from sciatic pain, don't wait until you have an inflammation to start doing some of these exercises or taking on some of these treatments. Be proactive. So, if you haven't been walking, start walking. If you haven't been stretching, start stretching. If Kegels is something you ladies, you can try that. Well, I get to understand men can do Kegel exercises too. I need to look into that. Since you were talking about muscles in the pelvic area. So, yeah, I do believe I read somewhere that men should do pelvic exercises. It's 11 minutes past the hour. I just thought I'd mention that. It's interesting. I look up at the clock sometimes, and more often than not, it happens at 11 minutes past 11. Pum pum pum. Hence my numerology broadcast last week. Okay, so while some rest or activity modification may be necessary in the treatment of sciatica, it is important to maintain as much activity as possible and avoid prolonged periods of physical inactiveness or bed rest. So, if you have surgery, though, you're going to have an extended period of bed rest. Well, I guess it depends on the surgery. If you've been in an accident, you could end up in bed for quite a while. If you've contracted COVID-19, you would have been bedridden in, well, much of the cases that I've heard of, where symptoms are severe. They have been in bed extended periods of time. So, if you have sciatica and you end up in any of these situations, it's looking quite bleak, pain-wise, for you at this point. Certain exercises to treat sciatica may be specific to the underlying cause, and trained health professionals, such as physical therapists, chiropractors, or qualified certified athletic trainers, can help formulate an effective treatment plan to relieve sciatica pain through exercise and physical therapy. So, Miss Althea, could you, I hope you're listening. If you're listening, if you could give us a call and quickly tell us what physical, as a personal trainer, if there's anything that you would suggest or anything that you would do to help someone suffering from sciatica. Not to put you on the spot or anything like that. If you're listening and you can give us a few minutes to share some exercises that could possibly work, I'd greatly appreciate of that. So there's also medication. Oh, okay. We might get lucky tonight after all. I guess you heard my cry for help. Good evening.
Greetings. It's been a while.
It has been a while. I hope I didn't take you out of your comfortable spot. Ladies and
I'm still in my comfortable spot. Doesn't mean I can't call and share. And
Okay, great. So, for those listening in, here is our resident massage therapist and personal trainer. And so, with looking at the subject of sciatica, they're saying that, simple things to help in the treatment of sciatica would include exercises. Now,
yes,
I don't know if massages would also help, since it's a nerve issue. But as a massage therapist, a licensed massage therapist, and a certified personal trainer, is there anything that you would suggest to those suffering from sciatica?
Well, definitely. That is a condition that I suffer from for years now. And one of the best things for me, since surgery is not an option, is stretching.
Okay.
Because even though it's the sciatic nerve that gets irritated, when you feel that sharp pain down through your butt and it goes down the side of your leg, and it just, like, for me, it's sometimes it stops me in my tracks. That's how severe it can be sometimes. It's also when the muscle around that nerve, it's really tight, and if you can think about, like, if you put your one of your your forefinger in between your other fingers and the opposite hand, and you squeeze it and you squeeze it and you squeeze it.
Yeah.
That's usually what happens when the sciatic nerve, when you feel that, for those who have sciatica or is diagnosed with it, that's usually what happens when you feel that sharp pain that just goes shooting.
Okay.
So stretching definitely helps me because it not only stretches the gluteus maximus, which is the nice thick butt muscle.
Mm-hmm. We like those. Well, at least looking at them.
It relaxes it as well. So stretching definitely, and also the hamstring muscles.
Okay.
Massage does help because whatever tension there is in that muscle, once the blood gets circulating through the muscle, it does alleviate some of that pain.
And I guess that's why they suggest heat also.
Yes.
Got you.
And my go-to whenever it gets to the point where stretching and the massaging doesn't work, my go-to is a chiropractic adjustment. I'm not sure if you spoke about that before.
I did not mention that at all. And I mentioned Dr. J. Dr. Jenny Stone. But I didn't mention getting chiropractic treatment.
That for me, like I said, you know how I am about any type of surgery, and I'm definitely into all forms of alternative medicine without having to take a pill or go under the knife. So that is my treatment of choice. And I can tell whenever I need a chiropractic adjustment, that's the first thing that starts to act up is I have issues with my sciatic nerve, and it's just like it becomes inflamed. It becomes a point where I'm walking and all of a sudden you'll see me stop and just like take deep breaths. And that's when I know I am overdue for an adjustment. I'm waiting to get that adjustment. And these are the things that I do is I do actually massage the area. And I do get, whenever I exercise, I get the assistance of my trainer to stretch my hamstrings and, whatever, to the muscles in the lower back.
Got you.
So a good way to get those muscles stretched is to lay flat on your back, lift your legs straight up, and if you can get someone to gently, not just, not real harsh or rough or anything, just to push the legs back, and preferably do them one at a time.
Okay.
And just gently rock it back and forth, and as the muscle is loosening up, you'll notice that the leg comes further back.
Got you.
And you want to do that for a good 10, 15 seconds. Bring the legs back down. Have the muscle shorten itself again, and then you pick it back up, lift the legs back up, and have the person do that. And about a good 2-3 rounds of that.
Alternating the legs.
Alternating the legs.
Got you.
And about 2-3 rounds of that, and I feel relief, almost instantaneously.
So, would you recommend doing that stretching on a regular basis, or just when the pain comes on?
On a regular basis, because the more you stretch, And the more flexible those muscles are, the less, not that that's going to be the end-all, cure-all for the sciatic nerve pain.
Mm-hmm.
But when those muscles around that nerve relax,
Wait, say that again. When those muscles do what?
when those muscles around that nerve
Yes.
is more relaxed,
Mm-hmm.
then the symptoms won't be as severe.
Gotcha.
And if you don't have, if you're not able to get assistance with the stretching exercise I just described, when you're sitting, preferably not to do this on a hard surface, but like when you're in bed
Mm-hmm.
and you sit up, you straighten, stretch your legs out in front of you, and you bend over. You try to touch your toes and go as far as you can, and you still do that back and forth movement.
So that
Yeah.
stretches your back and your hamstring.
Yes.
Got you.
And that slight back and forth movement. Notice that even in the beginning, if you're able to touch your toe, if you do it, the slight back and forth movement within a few seconds, 30, 45 seconds,
Mm-hmm.
if you're not touching your toes, you're getting pretty close. And that's how you know that the muscle is relaxing, it is stretching, it is getting that nice, good blood flow through it.
Right. Okay. So, would you, as I'm thinking about the leg stretching and that exercise that you mentioned with having someone, if you have someone available to do it, if you don't have anyone available, isn't that one of those exercises you could do with a towel? Like you put the towel,
Yeah.
but you have
Yes.
to keep your legs straight. So I guess you'd put the towel on your foot.
Either your foot or around your ankle, and
Gotcha.
it's straight. Yeah, but it has to be the extremity that around your knee, and the foot has to be straight. The leg has to be straight.
Okay.
In order to get that really good stretch of the hamstrings.
Mm.
And you're not only stretching the hamstrings, because remember, all of our bones and muscles is connected. If your calves are tight.
Are you stretching right now as we're talking? Because your phone goes in and out, kind of like it's muffled at times, and then it's clear.
No, I'm not. I'm not actually stretching. I apologize for that. I will try to be still, but yeah. So one of the benefits of keeping the legs straight is, like I said before, joints and muscles and tendons and everything are connected. So if your calf muscles are tight,
mm-hmm.
there's a very good possibility that you're going to have tight hamstrings. And if the hamstrings are tight, the muscles, the gluteal muscles, whether it's the maximus, which is the big one in the back, or the minimus, which is the one on the inside, or the medius, which is the one on the outside.
Right.
Those muscles are probably going to be tight. You remember when that song that we learned, that this bone is connected to that bone,
Right.
and that bone is connected. Yeah. So are the muscles. So if you think of all the muscles in the back of the leg, if you keep them relaxed and you stretch them frequently the correct way, then the symptoms or the pain that you get when that sciatic nerve is irritated,
mm-hmm.
it usually tends to not be as severe as if you continue to let those muscles be tight.
Gotcha. Yeah, because I'm as you're describing it, and talking about it, I'm visualizing some of those exercises, and as someone who doesn't suffer from sciatica, I know the feeling that I get when doing some of those stretches. And so I with imagining what someone with sciatica what they go through, then, I can understand such an exercise, or that kind of exercise. It's funny that we're talking about this. I scrolled down a little bit past some of the information that I have, and it shows chiropractic therapy, and it shows massage therapy. So now, of course, it also has lumbar therapeutic injections, being your epidural steroid injection, and
And for
nerve
some
blocks.
people,
Yes.
yeah, and for some people, it may be that severe alternative.
You cut out again.
Okay, I'm not. It must be the service because I have not moved.
Okay.
Okay, as I was saying, for some people, that the alternative medicine may not be effective.
Yes.
They may have to go, that route where they're getting the injections.
Got you. So, well, like they said, those would be your severe cases.
Right.
So those people would be having the sciatic pain for, I guess in excess of 8 weeks. Now, 2 months of sciatica pain seems like a long time, but you have to go through all that before being considered even for surgery.
And, it depends on who your medical professional is.
Yeah.
And, of course, we know Big Pharma, and we know about insurance companies and what us as patients have to go through before we can, we can get certain treatments.
Right, right.
And sometimes the treatment that it's best for us, the insurance company will not cover it until you do certain things, until you take those epidurals, until you take the pharmaceutical, the pills or whatever.
Right.
So it's, for some people, the only option that they have is to go the route where they're getting the epidurals.
Which in and of itself is pretty dangerous.
Yes, it is, and it's like putting a Band-Aid on a gunshot wound, because the epidural, it provides temporary relief.
Right.
But it does not cure the symptoms when that sciatic nerve gets inflamed.
But getting that temporary relief, because to get to the point of an epidural, you'd have to be experiencing some severe pain. So if you get to that point of getting an epidural and it relieves the pain, then you can do the exercise that is necessary to help with everything else. So
that's also true.
It kind of puts you in a better off position without going to the extent of something more invasive like surgery.
Right. So it's even though it's a temporary fix, for someone who wants those epidural shots.
I lost you again. For someone
Okay. For someone who does not want to continue to get those epidural shots, that initial shot might be all right. Well, I've been in pain for X amount of weeks. and I need to start functioning again. Let me go ahead. Let me get this shot. And they're not just going around and pretending as if, that shot is the end all be all, the cure all.
Right.
They start doing something else that will have a more long-term effect. Then yes, that is something that they can consider.
Okay. So, okay, and again, it has its place. It gives you that relief that you can go on to do other types of treatments to make you more comfortable for a longer period of time.
Right.
Okay, cool.
And for some people, the pain, they're to the point where they are in so much pain because it is very painful.
Mm-hmm.
And the few episodes that I've had, they've been far and few between.
Okay.
But when I get them, they're severe. And it doesn't last for a long time because I know what to do for myself in order to relieve or alleviate that shooting pain.
Do you have any clients, whether for massage therapy or personal training, that experience sciatica pains?
Not that I'm aware of.
Okay,
but
cool.
if anyone is listening who's received one of my massage, one of the things that
You went low again. One of the things that what?
One of the things that I do for those who are listening, and of course, I'm sure that you will attest to this, those who have received my massage.
Fall asleep.
No, not that.
Oh, okay.
That's true as well. But tying everything back to tonight's topic is I do stretches during my massage.
Yes, you do.
And I stretch the arms, the limbs.
Mm-hmm.
I pull, I lift, I twist, I stretch.
Mm-hmm.
And that is part of the relaxation that allows you to fall asleep.
And it works very well.
And a couple times you've, I don't know if I'd call you a weekend warrior.
Oh, yeah,
when it
definitely.
comes to, weekend warrior when it comes to soccer, but you've pulled a couple muscles at times that
Yes.
I've had the privilege of actually massaging it and stretching it.
I can't thank you enough.
You falling asleep is thanks enough.
Yeah, knock me out. You want to knock me out? Give me a gig. Order me. Treat me to a massage from this woman's healing heavenly hands. I'll be out. Talk to me tomorrow. Gone.
And it's overall when we do things like this.
You're low again. When we do
When
things
we
like
do when we do things like this for ourselves,
Yes.
when we get those massages, when we exercise, when we are active, when we eat healthy,
Mm-hmm.
Not to say that that you're not going to have these ailments, but if you do, possibility stands that they will be minimized.
Right. Because you're being proactive in treating
Yes.
them and, well, actively treating them in some cases.
Yes, but definitely stretching, for most people, when you get out of bed in the mornings, we're just so used to just sitting up, standing up, and just keep going.
Right.
Without thinking that you've been still for between 4 to 8 hours. Most mornings when I get up, if I don't stretch, I can't move.
Gotcha. Makes sense.
And, whether it's stretching the neck because we may not have slept in that optimal position that supports our spine and our muscles. We may have worked out a little bit too much the day before, and those muscles are really sore and tight.
Yeah.
Oh, and for whatever reason, the first thing I do when I get out of bed in the mornings is stretch.
I stretch too. It usually comes with a yawn, but I stretch.
However it works for you, doing simple things like that will, tend to make those muscles not so tight. And if anyone who's had any type of spinal, not necessarily spinal, but disc injuries.
Yes.
Stretching, and I don't mean you have to stretch where you stand up and bend over and touch your toes. Some people are not that flexible. But just move and stretch, and sitting down, for those of us who work at a desk, sitting down the majority of the day, it is so essential to actually get up and stretch every 30 to 45 minutes.
I notice since getting a smartwatch, because clearly I'm not smart enough to read a regular watch, it has told me when I'm sitting for an extended period of time that it's time to get up and move around.
Yes.
So, our smart devices can be quite helpful in things like that. Really quickly before we go, I just lost my train of thought.
Really quickly before we go, you were going to ask something.
I was, and it had to do with Kegels and pelvic exercises. Would you have you ever tried that in addressing your sciatic pains?
I do those exercises just to do them. I did not, no one has ever mentioned or suggested it to me to do them as a part of the relief for my sciatic pain. I've got to ask my chiropractor about that.
Yeah, I was thinking of asking Dr. J about that too. So
yeah,
I don't know which one of us will get to her first, but let's see what we find out, right?
And I mean, whenever our core muscles are strengthened, that entire portion of our body tends to experience less trauma, less pain, less injuries.
Oh, so we can do planks then, and yoga.
Of course.
Okay. So plank challenge. Who's gonna come up with a plank challenge? 773-789 Stu, hit me up. Tell me what the plank challenge is, and I'll put it out there to everyone. Plank challenge. No, you're not allowed to do it.
I'll see what I can do. Why not?
You're not allowed to give the plank challenge. You're a personal trainer. You're not allowed to give the plank challenge. I want regular people to hit me up. Let's do the plank challenge.
I am a regular person because I still do planks. I definitely can increase. I definitely can increase the amount of the length of time that I plank. So I don't mind coming up with a plank challenge.
The mere fact that you said you could increase that right there, yeah. You
gotta start somewhere in order to be able to increase, right?
Yeah. I'm starting from zero, so I'm going to I don't know, 10 seconds. Who's joining me? 10-second plank challenge.
You'd be amazed at how long you can hold that position for. And then I'm gonna bet you
Wait.
that
Adjust your mic so that everybody can hear. You're going to
I
bet me
am
what?
I am going to bet you that you can hold that plank position for at least 30 seconds just to start from the get-go.
You see, that right there is how I end up in the hospital in 2 weeks. Trying to do
You
this
have
third
my
step.
word. You have my word. You will not end up in the hospital.
Ladies and
One thing
gentlemen,
that I can guarantee you though, you're gonna have some killer abs. You keep doing them planks.
ladies and gentlemen, you hear this personal trainer trying to send me to the morgue. Um, Go ahead and call her up and make your appointment.
You know what? Just for that, you just gave me an idea.
Oh Lord.
I'm gonna post something on social media about that plank challenge.
Okay. The night shift plank challenge. Let's go. Let's go with it. Or the healthy love plank challenge. Let's go.
The Healthy Love Plank Challenge, and I'm going to do a video of myself and doing my planks.
Tag me in it so that I can share it to everybody. Go on.
Okay.
Let's do it. We're gonna do it. That is what it's going to be. It's going down.
And what the intention is going to be is for people to post their videos or pictures of them for this challenge.
Let's go. Let's do it.
And the first one on there is going to, after mine, is going to be yours, right?
Let's go. Let's do it.
Okay.
I didn't say yes, but let's go. Let's do it. Althea SU, thank you very much for joining us. Ladies and gentlemen, hit her up 954-655-9000, 954-655-9000. Talk to her about your massage therapy, your personal training, and see what she can do for you. Make your arrangements. Broad County, North Miami-Dade, and South Palm Beach counties. Hey, you have somebody available. Call her up. I do. See, she's on the call right now.
You know, and the personal fitness is mobile as well as the massage therapy.
Perfect. Alvia, thank you very much. You have a great night. I'm going to jump into musical therapy, get a couple of tunes in, and call it a night.
Well, thank you for allowing me to be a part of tonight's show, and I hope I was able to, provide some good information to the listeners, especially those who may be suffering from sciatic pain, because
Yes.
I know how painful it can be when those when they have those episodes. So,
Really quickly, do you take NSAIDs or any oral steroids, or have you taken any for sciatica pain?
no.
Okay, cool. Just wanted to know.
Yeah, no. It's been recommended,
Mm-hmm.
not by my chiropractor,
Right.
but it's been recommended by others who don't know me too well. Why don't you go take take an anti something? No, this pain will go away. It may take a little bit longer,
Mm-hmm.
but my methods are longer lasting. It's not that quick fix.
Okay. Well, that's what we want. We want the longer lasting effects.
Yes.
Cool. All right. Now I can jump into musical therapy comfortably. Thank you again, Althea. Truly appreciate of you. We'll talk.
What time you jump?
Wait, you cut out again. Say what?
I said, watch how you jump, though, because we don't want any injuries while you're jumping into musical therapy.
No, I'll jump lightly.
Okay.
I'll be the Dick Van Dyke of jumping tonight. You know, oh, yeah.
There you go.
Also, you remember Mary Poppins and how they
Yes.
did the umbrella thing? Yeah, I'll chimney
Just
me.
ease on into musical therapy.
There we go. That just like you see, you can't know the
Easy
regulars.
does it.
You know. You can't know the regulars. Thank you. As we-
My pleasure. Good night, everyone. Good night, DJ.
All right, good night. As we kick off musical therapy with a little His Run. The track is called Man on a Mission.
Anybody who tell me something we can't do it.
12 minutes to the top of the hour.
Here I am. Here I am. Oh. Man on a mission.
New music from His Run. It becomes available this coming Friday, the 28th of May.
Man on a mission. Yeah.
It's called Man on a Mission. And we're on a mission tonight to address sciatica
The lion is asleep.
and take on the Healthy Love Plank Challenge.
The jungle mumbles. When the lion is awake, all heads bow, the jungle humbles. We just ordinary people doing extraordinary things. Smallest eyes rock the biggest bones. So who said we can't be done? Well, here I am, ready for the test, ready with a clasp of hands, yeah. Here I am, a man on a mission, yeah. A man on a mission. I'm a man on a mission. Man on a mission. We still up on the battlefield, still hungry for the belief. If you believe you can achieve it, and when you see, just take it. The world is yours, the world is mine. Let's live our dream, yeah. So who said we can't? It can't be done. Well, here I am, ready for the test, ready with a clasp of hands, yeah. Here I am.
As we go through this musical therapy, I want to say thank you to my segment sponsor, GMAT Music Solutions, bringing your events to life, providing sound, light, stage production services, musical equipment, PA systems, audio engineers, DJs, bands, musicians, and singers. Give them a call, 754-307-GMAC at 754-307-4622, or hit them up on gmatmusicsolutions.com. Tell them DJ Kevin Stew sent you.
Ready for the test, ready with a clasp of hands, yeah. Here I am, a man on a mission, yeah. Man on a mission. I'm a man on a mission. Man on a mission, yeah. I'm a man on a mission.
Say you're a soldier, a ragamuffin soldier. Say you don't need no one to make it in this world. But
This is out of Liba.
unity there is,
Liba Hibbert.
and there's no way we can survive.
The track is called Raga Soldier.
Need me like I need you. We should be united in unity.
sound of Mr. Ed Robinson.
Serious news to pass on.
Track called Love's in Need of Love.
Everybody, what I'm about to say could mean the world's disaster. Could change your joy and laughter to tears and pain. It's that love in need of love today.
If there's one thing that we do need, it's a lot of love.
Delay, send yours in right away. Oh.
We see all that's going on around us.
Going round.
All that's happening in Israel. All that's happening right here in the United States, in the Caribbean.
Before it's gone too far.
A lot of this can be addressed if we just recognize what love is. As we rock on out of here tonight, I want to encourage y'all to look out for members of your community. And just to remind you that your community is not just a development that you live in, it spreads far and wide. So those that you pass as you go about your day, traveling on the bus, the plane, the boat or the train, whether you walk, ride or drive, these are members of your community. Do something good for one of them today, because you never know who's going to do something good for you tomorrow. Speaking of tomorrow, remember to join me to close out the night shift week with a Real Talk Wednesday. Tomorrow we address the issue relating to gender-biased wage disparities. Look forward to having this chat with Ryan Greensberg, Dr. Keisha Gray, and Nicole McClure. All being well, this should be quite the chat. This is where I bid you all a farewell. Until then, good morning, good afternoon, good day to you wherever you are in the world. From right here in South Florida, I bid you a good night to all my affiliates. Island Worldwide in New York, NIE in New Jersey, One Harmony Radio in the UK, Foundation Radio Network, ClintonLindsay.com in South Florida, WGLRO in Texas, Hollywood Radio, Dosic Media Groups. Much love. Y'all take care.
Send yours in right away. Oh, yeah. Can you believe it's going round? And it's breaking hearts. It's breaking hearts. Stop this, please. Stop this, please. Before it goes way too far. Love's in me. Better believe it.
Yeah, you better believe it. Good night again. Y'all take care. Let me get on out of here. Until tomorrow when we close out the night shift week. Blessings to you. Greetings and salutations, one and all. You're invited to tune in to the night shift with DJ Kevin Stew. It airs on Mondays with Community and Finance, Tuesdays with Healthy Love, and Wednesdays with Real Talk from 10 p.m. to midnight Eastern Time. Come spend some time interacting in the stew pot where we keep things bubbling and wind down in musical therapy. The night shift with DJ Kevin Stew is on kevinstew.com, where you're encouraged to have acceptance to enlightenment.